Netflix and asthma meds. So first, we're going to talk about what is asthma. So the air you breathe is a big part of your asthma. Asthma is indicated by acute bronchospasm. It's normally a chronic condition. It's one of the forms of COPD. So it is something that many people are diagnosed with, but mostly related to bronchospasm. There's not a ton else to asthma, really. The symptoms are almost exclusively in the lungs. We're going to talk about a couple different prototypes within asthma. The reason we have emergency up here is because they're both rescue inhalers. So we've got albuterol and atrovent. Albuterol's scientific name is albuterol. Atrovent's chemical name is ipratropium bromide. So we'll be calling it atrovent from now on because I don't think any of you want to listen to me try to say that over and over and over again. Albuterol is a short-acting beta agonist, and atrovent is mainly designed for those who can't tolerate those short-acting beta agonists, which we'll talk about a little bit later. Atrovent is an anticholinergic drug. So, beta agonists. Beta agonists provide bronchodilation in the body, which helps to get more air into your lungs. So short-acting beta agonists like albuterol are designed specifically to dilate the bronchial smooth muscle and allow you to get more air to your lungs. They do activate some beta-1 receptors in the heart, so we'll talk about that as well, but they're mostly beta-2 agonists. The anticholinergics, on the other hand, the atrovent, works a little bit differently in the body. Again, it's relaxing the muscles. It's decreasing the activity of the parasympathetic nervous system. So it's helping you to get more air into your lungs, again, by causing that bronchodilation. So both of them are about getting more air into your lungs. We also have the atrovent that can be used more long-term and less of an emergency, but both of them are designed to be used as rescue inhalers as well. Our next movie is before and after, so we're going to use Meryl to talk about a couple things, because she's the best, obviously. So this is to remind you that all of your labs need to be monitored right before and right after administration. And there's not really a ton of labs that go with these because they are short-acting medications. So when we talk about labs, we're really talking about vital signs, which now we're bringing Diane into the picture as well, and Jimmy Smits, in case you have forgotten about him since NYPD Blue. So you've got some time with those. Vital signs are going to be your main one. Albuterol can cause some hypokalemia in really large doses, but hopefully you're not really taking a large dose of albuterol. So you're going to monitor those vital signs specific to respiration. So respiratory rate, rhythm, quality, look at your patient's positioning, look at their skin color. Basically you're trying to determine if your patient is receiving enough oxygen. So you can also look at things like your pulse ox or cap refill, make sure that they're perfusing. So you've got a lot of different ways to monitor that. We'll talk about it as well in the sense that you need to monitor your patient's heart too, but that's more of a patient history thing. So one thing that's really critical, especially with those beta agonist drugs, is the cardiac effects. Because it is a beta agonist, it could act on those beta 1s as well, which could cause that tachycardia, increased heart rate. So you want to make sure that your patient using the albuterol or another short-acting beta agonist doesn't have any history of cardiac effects like hypertension or heart attack, because it could aggravate those symptoms. Whereas with the anticholinergics, like the atrovent, you're looking for a history of anything that could be made worse by an anticholinergic. So all of those things that we've talked about in class, like BPH, renal disorders, urinary bladder obstruction, because all of those things can be made worse by an anticholinergic effect. So in addition to monitoring your patient before and after, you're really going to wait and make sure you have an accurate history as well. Next, we're going to talk a little bit about mechanism of action of both of these drugs. It's most common that these drugs are inhalation. So most of these are in metered dose inhalers. They can be delivered in other manners as well. The atrovent, it's pretty common that it's also available in a nasal inhaler. And that, with atrovent they're using it more for resolving a runny nose from a common cold or from allergies. But for the most part, we are talking about the inhalers, like this lovely collection behind me here. So you're looking at a metered dose inhaler. That should be administered PRN, so as needed for acute bronchospasm. So when you're actively having an asthma attack is when you'll be using one of these metered dose inhalers. Not really recommended for prophylaxis, but you can use them, especially albuterol, about 15 to 30 minutes before exercise, and that may help prevent some exercise-induced asthma as well. The next thing we're going to talk about is some dietary considerations. One main thing with albuterol is caffeine. So we've already talked about the cardiac effects a little bit, but with caffeine specifically, it can cause an increased heart rate and palpitations. It may also cause some tremors. This is one of my favorite movies, so we had to find a way to work it in. It can cause some tremors. The hard part about this is that that's what a lot of you look like before you've had caffeine, so you have to make the choice between having those tremors or being a man-eating monster during the day. Effects of these medications are pretty slim. Most of the other side effects of these medications are pretty mild and they're pretty rare. So with the albuterol, with that short-acting beta agonist, you may see things like the palpitations, maybe a headache, tremor, nervousness, whereas with those anticholinergics like atrovent, you may see more of a cough, respiratory effects, hoarseness. Those may also leave a little bit of a bitter taste in your mouth, so you may want to, in your patient teaching, talk to your patient a little bit about rinsing their mouth after they use atrovent or another anticholinergic drug. One thing with the anticholinergic specific to diet is that a lot of them have soy lectin as a propellant in the inhaler. So if your patient has a soy allergy or soybean allergy, they may actually react badly or have an anaphylactic response to that drug. So again, patient history, looking at allergies, cardiac effects, anticholinergic conditions, you're just going to want to look at all of those before you're doing this with your patient. Some side effects that you may experience, the big one, honestly, is this crazy heart rate. So you're looking at the tachycardia. Again, that's from the beta agonist acting on those beta 1 receptors in addition to the beta 2 receptors that it should be acting on. So that's one that's a really big side effect. One other side effect that you may see from the albuterol specifically is an increase in blood glucose levels. So you need to monitor your patient's blood sugar, especially if they're diabetic or hyperglycemic, because you could see a spike in their blood sugar from the use of these medications. It's usually not drastic enough to cause a problem, but it is something to be aware of with your patients. Next few things we're going to talk about are patient teaching and also when to notify a doctor. So one thing with patient teaching is that these drugs have to be used right now. When you're having a bronchospasm, you're not breathing. So it can lead to your patient being completely unable to breathe. They really do need to act now with these medications. So it's really important that they administer the medication right away when they're going through. So tell their family that at the first signs and symptoms, they really do need to be using their rescue inhaler. Next is that they need to know what triggers their asthma. So asthma can have a lot of different triggers, anywhere from allergies to pet dander. I mean, your dog could cause an asthma attack. There's seasonal allergies. There's conditions, people running or exercising can cause allergies. Something in your house or something in your workplace can cause your asthma. So it's definitely important to know what your triggers are and try to avoid those as much as possible when you're going through. And then the biggest thing with your asthma meds and patient teaching is really going to be proper use of your rescue inhaler. So this is not something that's intuitive to patients, and it's not something that's usually done properly when you see it on a TV show. So when your patient uses their inhaler, first of all, they're going to want to prime their inhaler. So you've got one of these guys over here. Take the lid off. Let me put my wine down, which I'm hesitant to do. Take the lid off, and you're going to want to prime your inhaler. So you're going to want to give it 2 pumps to spray it twice. That's before you use it, and if it's been a while since the last time that you've used it. And then you're going to want to instruct your patient to breathe all the way out, and then use their inhaler. They're going to depress it once, and they're going to take a deep breath in. Then they're going to wait to exhale. So you have a Whitney over here to remind you. R.I.P. Whitney Houston. One of her best movies if you haven't seen it. So you're going to want to wait to exhale. You're going to want to give that drug an opportunity to work in your lungs. So after you've done that, then you're going to wait a couple of minutes, 2 to 3 minutes before doing it again. Usually meter dose inhalers are prescribed for 2 inhalations. So you're going to want to be sure that your patient knows to wait in between. If you're using a beta agonist and an anticholinergic, you're going to want to use the beta agonist first to dilate your bronchioles as much as possible before you give that anticholinergic an opportunity to work in your system. Lastly, again, you're not breathing. So if you notice that your medication is not working, the most important patient teaching really is to notify a physician or get to a hospital as soon as possible.